Welcome to tonight's event. We're going to get started. Thank you so much for joining us for our topic tonight, which will be medical marijuana and autism. Hi, hello, welcome. My name is Michelle, and I'm the Director of Physician and Network Engagement for the Apothecarium. Before we get started with our speakers tonight, I just want to tell you a little bit more about the Apothecarium. The Apothecarium it was founded in San Francisco in 2011 by a gentleman named Ryan Hudson. Ryan's vision was to build a dispensary where people could be proud to bring their moms and their dads. Our goal at the Apothecarium is to really put first-time visitors at ease with a beautiful atmosphere and a friendly and knowledgeable staff. The Apothecarium dispensary has 3 locations in Pennsylvania: Thorndale, Plymouth Meeting, and Lancaster. We're a full-service, award-winning medical marijuana dispensary whose mission is to provide our patients with quality medical marijuana medicine in a welcoming environment with empathy, support, and ongoing education. In addition to running monthly education sessions like the one you're attending now, we also offer discounted virtual certification events. We offer these events twice a month in partnership with approved physicians throughout the state of Pennsylvania. And these physicians are so kind to offer discounts, $50 for renewal and $100 for initial certifications respectively. If you would like to register for one of our events or learn more, you can go to apothecariumpa.com/events. And just to introduce you to our speakers tonight, we have Dr. Charles Harris from Alternative and Integrated Medicine. I'll let him tell a little bit more about himself as he's up next. And then we also have our very own Fran Kopko. She is a registered pharmacist, and she is also the Director of Education and Medical Professionals for the Apothecarium. So with that said, I'm going to turn the floor over to Dr. Harris, and we're going to talk about autism spectrum disorder and medical marijuana. So thank you again. And if anybody has any questions during the presentation, please utilize the chat feature or the Q&A. And as soon as we're done with the presentation, we will answer all of your questions. Okay, so I will turn it over to Dr. Harris now. Thank you.
Thanks, Michelle. Hi, everyone. I want to thank you all for joining us, your interest and your time, taking the time to join us today. And especially I want to thank the folks at the Apothecarium, the staff there for organizing the webinar. First, I'd like to share a bit of my journey, how I ended up here at the medical marijuana space, especially treating kids with autism spectrum disorder. So I'm actually an emergency physician. I've been practicing emergency medicine full-time for over 35 years now. I'm an extremely medically conservative physician. Growing up, I never used marijuana in college or high school or anything. I was more of a beer guy, actually. But we started looking into this about 4 years ago. My wife and I, she's a former cardiac cath lab nurse, and now she's a certified cannabis nurse. And the more we looked into this, the more we learned, the more excited we became and started seeing patients. In January 2018, we opened our little office in the Lehigh Valley, just outside of Allentown. And we started seeing some amazing results early on. So it's been quite a journey here. And I wanted to share some of the amazing results that we've had with our autistic patients. Now, I'm going to be talking a lot about the science of autism, the neuroanatomy, neurophysiology, neurobiology. So it's going to be a bit dry and it's going to go a little bit fast. But then I'm going to talk about results that we've seen, some scientific studies that have shown some amazing results, and talk about the results we've seen in our own patients here. So first of all, to talk about the human brain, it's an amazing organ. It comprises only about 2% of the volume of the human body, but it takes up 20% of the energy produced by the human body. We can go forward a couple of slides, Michelle. As I said, it's extremely complex. It's certainly the most complex organ that we know of in existence. The brain has many layers, and many regions, and each region has subregions, and each subregion has many layers. And the primary components of the brain The two primary components are the neurons, and those are the nerve cells that communicate with each other and process all of our information and store it. And then the glial cells, those are the cells that support the neurons. The way the nerves talk to each other is through synapses, which are junctions where the nerves connect with each other, and they send chemical signals back and forth, usually predominantly in one direction, and they pass the signal on to other nerve cells. The next slide is a kind of a diagram of that. The big reddish orange structure is the cell body. Off to the right is that tail. It's the axon where the signal goes down, and down at the end are dendrites and synapses. And there's really synapses all over the neuron. A closer look at the synapsis on the next slide is just a really simplified version of what goes on in the synaptic junction, that little cleft in between one neuron and the other. And this signal in this case is coming from the right-hand side. It sends chemicals into that cleft that impact the postsynaptic neuron, and then the signal goes on off to the next neuron. And this is just a really simplified slide. It just talks about basically the cannabinoid receptors and a few of the processes there. In normal, we can skip through this one on. So generally in neurotypical development, the brain starts forming, the nervous system starts forming as early as 6 weeks in utero, and starts developing specialized tissue. It forms into a neural tube. It starts growing and developing specialized structures so that when you're born, pretty much your brain, the basic structures are in place. But from birth until age 1, there's just amazing growth. The brain doubles in size during that time and continues with amazing growth until the age of 2 years old. And by amazing growth, we're talking about 40,000 new synapses a second. So the growth is just phenomenal. It's an extremely complex mechanism, and it's controlled by lots of different functions. The next slide shows that actually in that time from birth, especially age 1, 2, and 3, there's actually too many synapses. So there's too many signals that are firing around, and signals are getting lost or getting reinforced where they don't need to be. And you're not really developing these finely tuned neural networks. There's a lot of noise going on. And the way that the human body, the brain, as it develops, controls that is by pruning. So just as you would prune away roses, the branches that you don't need or the flowers that aren't forming well, the brain has a process for pruning away the synapses, the dendrites, the axons that it doesn't need. And by pruning away kind of the unneeded ones, we're left with this finely tuned, very complex neural network that lets our bodies process information, store information, react to our environment. And it becomes just an incredibly complex mechanism without a lot of extraneous noise. And as my slide indicates, by the age of 10, generally we have pruned away 50% of our synapses. So we made all these extra synapses, and then we pruned them away, and what we're left is this lean, mean thinking machine. And on the next slide, it's just kind of the result of that is somewhere around 80 billion neurons in the neurotypical brain, and somewhere around 150 trillion synapses. So this is how our brain processes all this information. It's really an incredible machine. We'll switch gears a little bit and talk about autism a bit, and ASD, autism spectrum disorder, is truly a spectrum. I mean, that middle initial S, it contains so much information there. It's truly a spectrum because there is no one thing that defines an autistic patient. There are clusters of symptoms, and generally our autistic patients have deficits in communication, deficits in social interactions. They have patterns of restricted interests and repetitive behaviors, but they don't have to have all of these. And anyone that they might have might be very dominant or might be very diminished, or it might be very impairing. But generally it's these clusters of symptoms, and our patients go anywhere from mildly impaired patients, especially some of our older patients that just have social phobias, or they don't want to get out of the house, or they're awkward in conversations, to a lot of our younger patients who are nonverbal, have frequent meltdowns, 20 or 30 a day, just terrible, tantrums, or they're uncontrolled, no discernible cause for that. So it gets to be very complex. No one's ever discovered a specific cause for autism. There are a lot of genetic problems, that are contributed. We found over 100 specific genetic defects that can lead to autism. There are epigenetic factors. That's how our DNA processes proteins. There are environmental factors, infectious, inflammatory processes that can affect this. But we're left, many of the autistic patients are left with brains that have areas that are too thick or too thin or have too many connections. Especially the shorter connections can be a real jumble, whereas the long-term connections can be lost, or just not enough of those to communicate from one area of the brain to the other. As far as treatments, there's really not been an effective treatment, although lots have been tried. There's a lot of really good behavioral therapies that can help a lot. But as far as pharmacological interventions and anywhere near a cure, we've not really seen anything like that. The sort of meds that have been tried are selective serotonin reuptake inhibitors, sedatives, amphetamines, antipsychotic medications, and each of these come with a host of their own problems and side effects and adverse effects and addictions and things like that. So, as far as an effective treatment, it's been very difficult to find something that's well tolerated and works well. So many of our patients with autism have found to have neurotransmitter dysfunction. The neurotransmitters are those chemicals that communicate from one neuron to the next. The glial cells, those support cells, can be overactivated, which results in inflammation throughout the brain. It's like these little brains are just smoldering all the time. So not really seizures, which are organized activity, but almost like a subclass of a seizure where you just have all this activation, all this inflammation, and it results in the autistic symptoms. Certainly, many kids with autism have way too many neurons and way too many synapses. We think that in many kids, it's a product of a pruning malfunction. The next slide shows an example of this. This is from a study in 2014, a magazine Neuron. It was a study from Columbia University in New York City, where they looked at brains from autistic patients. These were cadaver brains from autistic patients and compared that to neurotypical. On your left-hand side, you'll see this is a neuron with the dendrites and the axons, and those tiny little buds along each branch, those are the synapses. On the right-hand side is the autistic neuron, and you can see that there's probably about 5 or 10 times as many of those little synaptic buds as on the neurotypical neuron. And this is what leads to many of the problems with the autistic brain. I found a slide from Nature from 2011 that shows this graph. I think it's a very nice, a very important graph that kind of summarizes my thoughts on the autistic brain and development. And the lines I want to focus on are the top line in magenta and the next one down, which is black. And in utero, the development of the brain progresses along quite nicely, and then at birth, it starts diverging where there's too much synapse formation in the autistic brain as compared to the neurotypical. That peaks out probably around age 12 or so, don't hold me to that, where the autistic brain starts having some negative effects and the brain size starts getting smaller, but it never really gets back to that neurotypical line, and there's a pretty big divergence there. And certainly this cannot be true of all patients with autism, but I think it's true of probably at least 50% of patients with autistic spectrum disorder. Switch gears again, and we're going to talk a bit about the endocannabinoid system. And strangely enough, we are born with our own cannabinoids and our own receptors. And this was studied first in Israel back in the 60s and 70s, where they were looking at THC, the primary psychoactive ingredient in marijuana, and they're going like, well, where does this affect the brain? There have to be receptors on the neurons for the THC to work on. And they found those receptors and identified those. They also identified the molecule THC and the other cannabinoids. And then they discovered about a decade or two later that we actually make cannabinoids ourselves. So our brains make 2 that we've discovered so far. There's probably at least several others. The primary one is anandamide, and the other one is 2-AG. Actually, I probably got those backwards. 2-AG is probably a lot more prevalent. But these are molecules that are made by the neurons and go across the synaptic cleft and affect the release of these neurotransmitters. And these cannabinoids are implicated in tons, just a host of functions of the human body. So that's our own endocannabinoids that are made on by ourselves. Now, the marijuana plant makes over 140 unique chemicals that we call cannabinoids. And I've listed a few of those here. The heavy hitters there, the ones that we understand the most and seem to have the most impact are the THC, tetrahydrocannabinol, and CBD, cannabidiol. And THC is the psychoactive component. CBD is not as psychoactive, although it can help anxiety. I've listed CBG because they're starting to look at that out in California to see if that helps autism. THCA and CBDA are the acid forms. Terpenes are very important. These are chemicals made by the marijuana plant that are also made by other plants, and they can help direct the function of the cannabinoids. So to talk briefly about THC, it works directly on the CB1 receptors, and the CB1 receptors are found on the neurons, the nerve cells. We also have CB2 receptors that are found on the immune cells, and that's the white cells that are throughout the entire body have CB2 receptors, and THC can work directly on those as well. So we found that THC tends to inhibit those areas of the brain that are overly excited, and those areas that are overly inhibited, it tends to stimulate or bring those more to life. And that's how the same drug can treat anxiety, by inhibiting that overexcitation, and can also help depression by those inhibited areas that can kind of start, getting those into action there. And that's a very simplified version of that. So we know that THC on its own is really great for pain. We know of at least 5 mechanisms by which it works. There's probably a dozen more. We know that it's a wonderful sleeping aid, and at lower doses, it can help anxiety. At higher doses, strangely enough, and this is a caution, at high doses, THC tends to make anxiety worse. So I always advise my patients to be cautious in that regards. CBD, on the other hand, is not generally thought to be psychoactive. We can go to the next slide there. So CBD, although it's said to be not psychoactive, it is, in that it's a good anti-anxiety medicine. But it does work on the receptor cell membrane, but it also works deeper inside the cell in several areas. It has a bunch of receptor sites in which it works. And it also bolsters the immune system too. Now, CBD on its own is generally not a great pain reliever. It can help with inflammatory pain. It can help especially with neuropathic pain. And that's the pain that, like, diabetics get in their feet because their nerves are damaged from their diabetes. And CBD on its own can help with those. On its own, it can help with anxiety, but generally at pretty high doses. The next slide, we talk about CBD and THC working together. And when you combine these two cannabinoids together, really some miraculous things happen. First of all, the CBD tends to buffer that high effect from the THC. And that's important because I have a lot of patients that take marijuana all day long, and they're not stoned at all because they're taking these forms that have a nice balance between the CBD and the THC together. So that's just one of the ways. Also, the THC and CBD products that are paired together tend to be some of the best for anxiety. Excuse me. So in our autistic patients, we see less anxiety. We tend to see less anxiety using this combination of medicines. We see better sleep, improved socialization, better communications, less stimming, less sensory hypersensitivity, improved dietary selection, less constipation, and the list goes on and on throughout many of the problems that our autistic kids face. So what I know from research that I've read, first of all, studies in Madrid and Caltech and Pasadena have shown that the endocannabinoid system does play probably a very significant role in normal brain development. We also know, first from a study in Stanford that was done in, I think, 2015, that autistic kids have a significantly decreased level of anandamide. That's that endocannabinoid that our bodies make its own self. Autistic kids have a decreased level of anandamide compared to neurotypical kids. That was confirmed by another study that was just published a little over a year ago from Israel. Dr. Adi Aran, who's just a brilliant pediatric neurologist, has done some wonderful research. We'll hear his name again a little bit later. So just like a patient who has diabetes, we know that they're insulin deficient, and we replace that with insulin. Maybe we should try and find some sort of replacement for anandamide, our endogenous endocannabinoid that's deficient in our autistic kids. And that's pretty much just what THC and CBD do. The next slide shows that the THC tends to work at the CB1 receptors exactly where anandamide works, so it kind of replaces anandamide for those functions. CBD inhibits the breakdown of anandamide and makes it so that there's more anandamide around. So just by that simple function, you can see how cannabis can work to improve symptoms of autism. We know that both of these chemicals reduce inflammation, which is important because these glial support cells, as I mentioned, there's a lot of inflammation in many of the autistic kids' brains, and THC and CBD work independently and together to reduce that level of inflammation. And as a result, it improves many of the symptoms of autism. So we're going to talk about results that we've seen. And as a physician, emergency physician, starting in January of 2018, certifying patients, and I started seeing autistic patients right off the bat. Our first month, we had like 3 or 4 autistic patients come in, and I'm saying to myself, my gosh, what am I doing putting kids on cannabis? Where's the support for that? Why did they add this on here? What's the science? What's the data? And there was almost none. I did find a small study from Chile. Dr. Quester and her associates took 20 kids, put them on various forms of cannabis, and they reported very, very significant results. About 2/3 of these kids had moderate or more than moderate improvement of their symptoms when they were put on cannabis. This report was very brief. The magazine it was published in didn't publish hardly any of their methods and materials, no doses. So I'm like frantic trying to advise my patients, what do you take for this? Next was a report from Israel, another observational study of 60 kids. No, let's stay on that slide for just a bit, Michelle. So the next one down is Dr. Iran. Again, he reported on 60 kids they were treating with medical marijuana. Again, it's an observational study. That means we gave 60 kids this, and this is the result that we saw. And what they saw was that 61% of the kids had moderate or very significant improvement. Again, that's pretty amazing. And I'm surprised that, we're not shouting it from the mountaintops. Hey, look at all these kids, they're getting better. We finally found a treatment. But observational studies are not the best sort of science. Excuse me, sorry. So because there's a big factor of a placebo effect. Next from Israel, 53 kids, similar effects, 74% got significantly better. The next slide has another 3 observational studies. Michelle, the next slide is going to show, again, a report from Israel. And this is 100 patients. And this was just a blog post, so it wasn't reported in any scientific journal. Next was another report from Israel, 155 kids, but this was out of about 350. So there were a lot of patients that were lost to follow-up, but still very significant results on the patients that followed up. Here in the United States, actually in Philadelphia, right here in Pennsylvania, Erica Daniels has her website is Hope Grows for Autism. She, with the help of Valera and through the Children's Hospital of Pennsylvania, they all coordinated together, and they reported on 50 patients. Again, this wasn't a published study, it's what's called a white paper, but very significant results. 50 kids that were treated with medical marijuana, 68% of them had moderate to very significant improvement of their symptoms with medical marijuana. Next slide starts going into my patients. I took a look this summer. I pulled out 21 of my patients that I'd had a really good interview at first and a very good 1-year follow-up. And I pulled out 21 patients. I used an autism paradigm stress index and started looking at what were the results there. The next slide shows one format of my results. This is what helped the best. So my scale is 0 to 3, with 2 being moderately improved and 3 being very much better. Sleep disturbances improved up to a level of 2.7. So you can see a huge improvement there. Restlessness improved dramatically. Injuries to others improved dramatically. Tantrums and meltdowns had a huge improvement, and injuries to self as well. And I just have to explain that when you have a 5-year-old who's pounding in his head frequently or banging his head against the wall or biting his arm nonstop, it's extremely distressing. And if we can make a significant improvement in just that aspect of autism, I think we've made a huge advance. On the next slide, we're looking at data a little bit differently, and these are of the patients that had tantrums. The patients where tantrums were a big issue, 100% of those patients did better on the medical marijuana. Patients with social impairments, around 90% did better. Aggression, about 90%. Sleep, 87% had an improvement. The next slide continues in this vein. Restlessness, bowel problems, and that's almost always constipation, self-injuring behavior, and communication problems. all those improvements were in the 80s. But again, this is an observational study, and I'll explain that just a bit. So if half my patients don't return, that means these numbers are going to be skewed to about half. If they didn't return because they didn't get better, I think that half my patients don't come back because it's too expensive, it didn't work, or they changed physicians. So the numbers have to be taken with a grain of salt, but still they're very, very impressive. What we really need is a double-blind, placebo-controlled, randomized crossover study that compares placebo to medical marijuana, and finally we got it. And this is the final graph reported by Dr. Aran. This was reported in Molecular Autism just in February 2021. So the ink is barely dry on the study. He did present this data to a conference about a year and a half ago, but it took him a long time to get published. So we see the P is placebo. 21% of kids had a moderate to very significant improvement just on placebo, but almost 50% using the whole plant extract got moderate to significant improvements. That's a lot. If I can put this into context, when we look at cholesterol lowering agents, you have to treat 70 patients to prevent one stroke or heart attack. In this graph here, it shows you have to treat 2 patients to have 1 patient with very significant improvement. So that's just an incredible result. In stroke, there was a study done in the late 1990s that showed that blood clot dissolving medicine had an 18% overall improvement over placebo treatment, and the world went crazy. We changed all of our stroke protocols. We set up stroke centers, the emergency department. When a stroke patient came in, everybody else got put on the back burner. And these are patients in their 60s and 70s or 80s. What we're looking at here is Dr. Aran is showing these kids that are 5, 6, 7, 8, 10 years old who have lifelong impairments. By treating them with cannabis, half of them do better. And we're talking about doing better for the rest of their lives. So it's information that we should be shouting from the rooftops, from the mountaintops. The improvements that I've seen in my patients have been miraculous in some cases. And we see it pretty much across the spectrum from patients that are mildly impaired to dramatically impaired. And we see little victories can just make huge difference. Like if you can get a kid who's nonverbal to start pointing at things when he wants something, or to be able to express in just a few simple words what his needs are, you can make those tantrums go from 30 a day to 2 a month. And that's just incredible. That's transformative for the patient and the whole family. And those are the sort of results that we've been seeing. So to kind of wrap it up here, this is what I think. I think that we're going to discover that medical marijuana restores the balance of normal brain development. There are certainly some indications of that. I think it brings growth and pruning into balance, or at least has that potential, and it can move that autistic brain closer to a neurotypical development. I think we're going to discover that the earlier we start, the more effective that's going to be. And I think that's about it. So I do have some websites here. I think on my last slide, do I have websites on there for my last slide? Here we go. So the first website is mine, AIMED420.com. Hope Grows for Autism is Erica Daniels' site. It's a wonderful site, lots of support, lots of information. I would encourage parents to join. WPA4A is Whole Plant Access for Autism.org. They have great data that shows what their kids are taking and what the results that they're getting. And medical, let's see, MAMMAUSA.org is Mothers Advocating Medical Marijuana for Autism, also a great website. So that's it. I'm sorry I went over a little bit there, Fran Mar, but I'll turn it over to you.
Oh, you're fine.
Thank you so much, Dr. Harris. And again, if anybody has any questions for either Dr. Harris or Fran Mar, as Fran Mar is talking about her part of the presentation, please, just type those into the chat or the Q&A and we'll answer them at the end.
You can go to the next slide, Michelle. There we go. Okay, so symptoms of autism. I think Dr. Harris kind of touched on a few of these. They're kind of broken down into 2 categories, communication and interaction, and then behavioral. So a lot of autistic patients might have usually more than one, hopefully not all, but a lot of these things in different levels of severity are going to, be issues for patients that suffer from autism. So when we have a lot of these parents of children who have autism, or, we have in the dispensary, we have dealt with some adults that have autism as well. These are a lot of the things that are discussed on, what's happening, what's going on, what we're kind of looking for, what we're going to then concentrate on. And then Michelle, if you can go to the next slide. Myself and the other pharmacists at the 3 Pennsylvania Apothecariums, I kind of took a little poll with all of them and said, when you have patients coming in, or caregivers or parents of autistic children, what are their goals? Because as pharmacists, as we're kind of hearing a patient's history, everything's starting to kind of come into our head, like, okay, we can do this for this or this for that. But the reality is, we want to make sure that we're listening to our patients as to what their goals are to improve, how things are going on and their quality of life. So these were kind of the top 6 that came up with the majority, obviously not all. Some of them, are just looking to do one of these goals, some multiple. So reducing the stimming, decreasing anxiety, sleep is always an issue, increasing focus, decreasing that aggression. And then, we do have a patient population of autistic children that also do suffer from seizure disorder. So sometimes we're treating more than one thing, depending on the patient. So cannabis and the different aspects of cannabis can help with all of these goals. So first off, the different cannabinoids. I tend to concentrate, Dr. Harris listed both THC and CBD along with a couple of others. Usually it's going to be THC and CBD that we're focusing on. THC, like Dr. Harris said, is going to provide more of a calming effect in slightly higher doses. It's a great sleep aid. It's going to help with a multitude of things. CBD, also going to help, Dr. Harris mentioned reducing inflammation. So we all have a lot of inflammation that's going on, especially, autistic patients. So the CBD is going to help reduce that inflammation. CBD is also, I like to call it an antidote for THC. So anytime any patient takes a little bit too much THC, and that THC is going to bind to that CB1 receptor. CBD is interesting because it doesn't really work on either of the CB1 or CB2 receptor. And the way it kind of helps be that antidote for THC is when that THC molecule is bound to that CB1 receptor, that CBD can come in and just slightly bump it off and just kick it just tightly off that receptor. So you're still getting some of the benefits, but you're minimizing some of those potential side effects, which is that higher euphoric feeling. THC in too high of a dose for some patients does cause increased anxiety and paranoia. So we're always cognizant to warn about that and starting low and going slow until we find our dose. Children are always interesting because we tend to start out children a little bit lower than what we would start out an adult. It always does surprise me though, because some of the children, once we're titrating doses up to find their, what we call their sweet spot, that dose that's going to have medical benefit but not cause side effects. Sometimes those sweet spots with kids are just as high, and in some cases a little bit higher than your average adult. So it's always interesting. And we commonly get asked, well, what's too much? Well, that's kind of a trick question because everybody's an individual who has each an individual endocannabinoid system with a different amount of receptors. So all 3 of us on the panel have a different endocannabinoid system with different amount of receptors. So cannabis would affect us each differently. And that's the same with any patient, including patients with autism. So we just kind of start low and find out that dose of where it's going to hit. Terpenes. I like to refer to terpenes as the essential oils of marijuana, essentially. So these are a couple that are going to help with children with autism in general. Pinene is going to be great because it's going to help aid in memory. It's a little bit to help with that focusing aspect as well. So for communication, linalool and bisabolol are going to be adding on to that relaxing type of effect, which is going to be great. So it's going to calm down that aggression, calm down and kind of mellow out some of that stimming. Calm everything down, so then hopefully communication gets a little bit better and we kind of translate that. Ocimene and caryophyllene are going to be very great for reducing inflammation. So those paired up with CBD is going to be a nice little bit to help decrease that inflammation that is going on within those patients. And then next is going to be different forms of consumption. It's very interesting. So normally, depending on what we're talking about, what the topic is, I tend to go over all of the different forms and break it out into short acting and long acting. But when it comes to autism, usually our patient base is going to be children for the most part. Like I said, we do have some adults, but it's going to be mostly children. Tinctures and solutions are usually what we are going to start children out on. Tinctures are going to get absorbed under the tongue and solutions are swallowed. So most children are just going to be able to swallow it. It's going to be put into juice or some sort of liquid and then just swallowed. Tinctures and solutions are interesting because they can be used interchangeable. So you can swallow a tincture and you can put a solution under your tongue. So kind of doesn't matter what it's called, it's going to be used for the same thing. Tinctures and solutions are great because we can really zero in on the dose and how much we're starting a patient out on, how much we can titrate up, and what then the end dose is going to be. So you can always, go up, go down. It's very interesting. Sometimes we can start a patient out on one product and have a little bit of a lower dose during the day, and a little bit more of a higher dose is going to cause more of a sedation type of effect. So we can use the same product at different times of the day at different doses. So we kind of almost get a 2-in-1 type of product. We do end up having issues when sometimes as the dose is titrated up, finding that sweet spot and kind of our dose discovery period, in that it's no longer cost effective. So it's costing too much money. They're going through a, bottle of tincture solution in a week to 10 days. At that point, we will consider switching to an RSO or distillate, which are going to be a lot more concentrated. They can easily be put into food and taken and swallowed, similar to the tincture or solution, which is great. And like I said, they're a little bit more concentrated, so less goes, a lot further. But it's going to be more friendly on the pocket, since this is kind of a cash deal and can get expensive as we're trying different types of products to figure out what's going to work, what's not going to work. And that, I believe, is it.
Thank you so much, Fran Mar. I didn't see any questions come through yet. Did you guys have any other additional comments? Questions do you have any questions for Dr. Harris?
Yes, of course I do. So Dr. Harris, myself and the other pharmacists of the Apothecarium, we obviously see many autistic children, parents or caregivers of autistic children, and kind of have an idea what we do with those patients. What do you usually recommend when you're starting out and seeing and certifying a patient for the first time? What's sort of the advice that you're providing parents or guardians of autistic children, and kind of where to start with their whole dose discovery venture?
Fran Mar, again, being, medically quite conservative, I generally recommend, and I put this in the comments on my certification as well, that I would really like the autistic kids starting off with CBD dominant products. We did have one that was a 1 to 19 THC to CBD, but that's no longer on the formularies here anymore. We do have a couple of growers that have the 1 to 10 THC to CBD ratio product. Then there's a gap. Again, there was a 1 to 6, but that's off the formulary now as well. So it kind of jumps down to, some of the RSOs or distillates, I think you can get as a 1 to 4 or a 1 to 2. But the RSO can be a little sticky, a little difficult to work with, and somewhat, shall we say, earthy.
Yeah.
But I have had some kids that tolerate the RSOs well and have done really, really well with those. And then there's, of course, quite a few products, the tinctures and the oils at the 1-to-1 ratio. So if they can start at the higher CBD end of the scale and get good results with that, I'm very pleased. And we do have, a good number of patients that use the 1 to 10 products, some of them with very low doses that are getting some very good results. But really our best results are, I think we're seeing with the 1 to 4, 1 to 2, and 1 to 1 products for daytime use. I certainly, don't want the autistic kids starting off with just straight up THC products. I think I think biochemically speaking and neurodevelopmentally speaking, I think I think eventually we're going to discover that that's a bad idea. My own conservative thoughts at starting at a 1 to 10 product is probably not. I think 10 years down the road, we're going to discover that there's a sweet spot there somewhere. I think it's going to be around 1 to 4. And that's mostly I get that from the website Whole Plant Access for Autism. That's kind of where their kids play out when they do their surveys. And the place where that we seem to have the biggest number of failures in our kids with autism being treated with medical marijuana is a great fear of the parents to give an adequate dose. And when you look at the graph from WPA4A, their average daily dose of CBD is 100 milligrams and THC is 25. Most of my patients don't get close to that. When I have patients, so often I'll talk to my patients to the parents, and they're 3 months, 6 months out, 9 months out, and they'll tell me we're just not seeing any results. And I find out they're taking a quarter of a dropper full of the 1 to 10, and I'm going like, well, the dose is just almost embarrassingly small, and it's not at all unusual that you won't get any results. So you just have to have kind of a leap of faith and go with the medicine. It's a very gentle medicine. It's a very benign medicine. No one's ever died from a marijuana overdose, and you can't say that about I'm an ER doctor. The other drugs that are used to treat autism, I've seen patients in trouble with all of them. Mm-hmm. But with the medical marijuana, it's really hard to have a bad result with that, unless you just go too high THC too fast, which, if you follow all the recommendations, you'll never get to that point, really.
Yeah, agreed. It looks like we have a couple questions come in. I think they're geared more towards me. So do the tinctures contain both THC and CBD? Yes, the tinctures in the dispensary, we have a multitude of different kinds, which is great. And I love the fact that the Apothecarium, not only do we carry our Alera grower processors, but we carry other grower processors as well. So we have a lot of options to choose from, which I love because it's not a one size fits all. So we do have tinctures that are all THC. We have tinctures that are 1-to-1, so equal parts THC and CBD. As Dr. Harris mentioned, there were some tincture solutions on the market that are no longer available just because some of these grower processors are getting bought out. So right now I believe there's just the one by Alera Ease tincture that's going to be the high CBD, that 1 to 10. And then sometimes we'll have some things in between. The grower processors might do, like a 2-to-1, 2 parts THC, 1 part CBD. Sometimes they get a little funky in there. and the difference between CBD available online versus what's in the dispensary. So all of the products that are going to have CBD in the dispensary, even if it's a high CBD product, is still going to have THC in it. The CBD that you will get out online at your local CVS, wherever, is going to have less than 0.3% THC, and it's going to be more hemp derived than necessarily cannabis, which basically means they took a cannabis plant, crossed it until it's just going to be producing that particular cannabinoid of CBD and not really any THC. So that's how they basically got a hemp plant from a cannabis plant. Yeah, so it's interesting because you'll have patients that will use CBD over the counter and get good results, and you'll have others. And my personal feeling is you kind of need a little bit of THC and the other cannabinoids and terpenes in there because you want that whole entourage effect. You want everything to kind of lift each other up. That's the whole point of the cannabis plant and how and why it works so well. Yes, Dr. Harris, I don't know if you have anything to add.
Well, after you're done adding, we have a couple more questions, but sorry.
Okay.
I was on mute.
I mean, I tell my patients, so many of my patients with anxiety disorder, when they come in and we start talking about CBD, they say, usually disparaging, "Oh, I tried that, it doesn't help." So I tell all my patients that first of all, over-the-counter CBD is kind of a crapshoot. I mean, you can get it online. There's so many sites online, and you can get it at the health food store. You can get it at the gas station, and I don't generally recommend anyone get their medicine at a gas station. But generally, the reason why it doesn't work for so many of our patients is because, first of all, you don't really know how much CBD is actually in there or what other chemicals might be. It's not well controlled at all. And second of all, generally, they try really low doses. If they even know what dose they tried, they might tell me that they take 5 or 10 or 15 milligrams of CBD a day, which is an extremely low dose for just CBD only therapy. So it's hard to find a reputable website. You have to check certificate of analysis. You've got to make sure that that's current and up to date, that everything is tested and they've ruled out heavy metal poisonings and fungus and bacteria and things. All that is done at the growers here in Pennsylvania through the medical marijuana program. All of it is extremely controlled. So the growers take dozens of samples. It's tested thoroughly for all of that. The amount of CBD and THC on every product is reported, and that's why you might see a product with one name that this month it's 4.1 milligrams of THC in a dropper full, and next month it's 3.8 milligrams of THC per dropper fulls, because they test every batch and they send samples off to Harrisburg so they can test it also. I mean, one of the reasons we run into flower shortages periodically is mold, and they have to destroy crops. So it's discouraging in that regards, but on a patient-centered basis, you're going like, well, that's good because I don't want my patients taking moldy marijuana.
Definitely not. So we have two more questions. First one is, do you recommend the Alera Hope tincture for starting out? So I'll let you take that one, Franmar.
So my answer is it depends. Like I said, when I did my part, we look to the parent, the guardian, the patient as to what their goals are. So our Hope tinctures, Hope 1 and Hope 2, are geared more towards, Hope 1 is geared more towards daytime use because it's a 1-to-1. So it's equal parts THC and CBD with specific terpene profiles in there. Hope 2 is a 5-to-1. So it's going to be a little bit more relaxing. So if I were to, not necessarily sedating, but relaxing and calming, that's how it kind of was intended. So if I have, a mom come in for her autistic child and her goal is that she's looking to have her child sleep more than 4 hours. Hope 1 and Hope 2 aren't probably my best options because they're probably not going to be sedating enough. So I might go with something else that's going to have a different type of terpene profile that's going to be more sedating. If I have a parent, same parent that wants something for more during the day to kind of help with focus and, just kind of concentrating and things like that, then Hope 1 is going to be a better option. So Yes, we do, but it just depends on the situation and the circumstance and what the individual is, what our goals are that we're trying to achieve. So sometimes they're going to be appropriate and sometimes they're not. Which is why, like I said, I love to have a different variety of options, because we try to really tailor our treatment plan to the goals of the patients and what they want to happen and how things they want to improve on to have a better quality of life.
Awesome. Thank you, Freymar. And the last question we have, it says, I am a 42-year-old on the spectrum. I have tried an array of products, but mostly vape flower. I have tried the Hope 1 tincture and I will try Hope 2 soon. Any recommendations?
So well, I'd have the question first as to what are your goals? What are you looking to make better? Because then that would be dependent on my answer back. And then kind of need a little bit of history there as to what else have you tried more specifically, so I don't, find the results out of that, so we can kind of get some information and move toward a better treatment plan.
Yeah.
Sorry, I know it's not a good answer, but sometimes we always say you might have easy questions, but doesn't mean the answer is going to be an easy answer. We usually have a couple follow-up questions before we can answer.
Yeah, and
so we do our due diligence.
And we can't really speak for what happens in other dispensaries, but please know that all patients, if you are in, geographical distance, are welcome to come to our dispensary at any time to have a consult, to sit with the pharmacist. It's free. It doesn't cost anything. It's not only on your first visit, it's on every visit if you want it to be.
Yeah.
So.
And we'd be more than happy to go over what you've tried, what your goals are, come up with a treatment plan, stay in contact with you, to do follow-up, tweak dosing, tweak frequency, which is great. So then we can kind of figure out, we always say the more feedback we can get back from you when something isn't going necessarily 100% the way you want it, the better chance we have then of adjusting accordingly and kind of pivoting that treatment plan to curtail it to you, because it is individualized. It's not a one size fits all.
Yeah, it's very individualized. We just had another one come through. Should I be cautious of trying this treatment with my 5-year-old? What are the risks? My pediatrician says it can actually hurt synapses. Any input on this statement?
Yes, I could weigh in on that. So I was at the kickoff for the the Hope products, and that's where I met Erica Daniels and some of the Alera folks there. One of there was a young couple there who had a child who was 5 or 6 years old, and they were very worried about starting, even the thought of starting their child on marijuana. They said that their pediatrician was recommending instead that they try one of the amphetamine products. And so I got out my little peripheral brain on my phone where I have my drug index, and I started reading the side effects from amphetamines that can have the side effects, including seizures, hypertension, high heart rate, hyperthermia, seizures, coma, and death, and psychosis, and just a lot of really terrible side effects. And I just mentioned them. I said, medical marijuana doesn't have any of those. You can get a little psychotic if you get carried away on your dose, but again, if you're starting low and going slow, you should never get to that point. And if you do, it's extremely transient. So when compared with the alternative treatments, and one of the favorites is the atypical antipsychotics like Risperdal and Zyprexa and Geodon, to be tried on kids. And one of the arguments that I hear is that, we don't have any long-term studies, the long-term effects of cannabis on kids' brains. We don't have any long-term studies on any of those drugs on the long-term effects. I did a search recently on Risperdal, and the longest study that I could find was a 1-year study, and it was very poorly done. It really didn't look at neuroanatomy and plasticity and those sort of things. So your pediatrician is correct. It can have an effect on synapses, and I think I addressed that, and I'm sure I addressed that in my talk. The child with autism, the autistic brain, the synapses have run amok. There's way too many. They're not getting pared down enough. And there is a growing body of evidence, although we have to eke it out from other studies, that show that the various components, especially the THC and the CBD, do have an effect on synapses, and they work indirectly to enhance pruning. So yes, it can change the pediatric brain. And we hope, and we've actually seen in our patient population, that it tends to change it for the better. I've had 2 kids that got started around age 5. One was 4.5 and the other one was 5.5, who symptoms were quite profound and have improved to the point to where they're only taking their cannabis, and this is 3 years later, they're only taking their cannabis as needed. So all the tantrums and meltdowns are pretty much gone. A lot of the anxiety, the improved communications, and they might be getting a dose of medical marijuana maybe once or twice a week to control when they're particularly agitated or anxious. One of my dads, the dad of one of the patients, said, have we discovered a cure for autism? And the answer is, it's much too early to say that. But I can tell you that in my experience and in all the research that I've done, I've not seen any medication that has as good effect on the symptoms of autism and has so few side effects. The big study that I cited, that last study, the double-blind, placebo-controlled, the really great 150 patient study from Israel, one of the main side effects they saw was a weight loss. When you dig down into the information, I think around 60% of those kids were on Risperdal, which causes weight gain. So probably getting put on marijuana brought their weight back to more of a normal. We see that all the time in all of our patients, that this is a very homeostatic drug, that it brings things, what drug will bring obese people and they'll lose weight, and people who can't eat and are cachectic and they gain weight? The same drug. It's because it brings everything back to a norm. And I've seen time after time where that seems to be the process with the autistic kids. So we've seen tremendous results in so many of our autistic kids. And as far as side effects, we've seen very little and certainly no long-term side effects.
Thank you so much. That was a very nice answer. And I know we're at 8, but we just had one more question come through. So I'm going to ask it since we're all here. Why not? If my child only swallows a tincture, is that okay? Is there a different action when metabolized by the digestive system versus under the tongue? That's a really good question. I'll let Grandma answer that.
Good question.
Yeah, so it's fine that the tincture is swallowed. It's going to, actually be metabolized differently, because it's going to, under the tongue, is going to go into those blood vessels that are under the tongue. Through, when it's swallowed, it's going to go through that gut digestive system. Differences, I should say, onset is going to be a little bit different. Anything under the tongue is going to be a faster onset, usually within 30 minutes, and the effects are going to last on average 3 to 4 hours. Anything that is swallowed, if it's going to be in liquid form, onset is usually 30 to 60 minutes, so a little bit longer, but the effects can last usually like 4 to 8 hours. The thing to know about, if anything is cannabis related, is going to get metabolized through the gut. If you could take a little bit of a fatty snack with that dose, you're going to get better absorption. So cannabis is fat-based. So if it has some extra fat of which to grab onto, peanut butter, avocado, if you want good fat, Nutella, coconut oil, some sort of fat, you're going to get a better rate of absorption. You can do it on an empty stomach, but then sometimes you lose anywhere from 10 to 30% of the absorption. So if you want kind of the biggest bang for your buck, just a little, peanut butter cracker. It doesn't have to, we're not talking a big meal, a big snack, spoonful of peanut butter type of, fat snack is all you need. And that's kind of the difference, but that's fine that it's being swallowed.
Okay. And then I have another quick question, and then just a statement, and we'll end with the statement because it's a very nice one.
Okay.
Are the tinctures flavored?
Some are, some aren't. So the ones by Alera are. Some of the other grower processors, yes, they're adding flavors to them. A lot of them are unflavored. If you want something unflavored, just, whether it's our dispensary, another dispensary, just ask to clarify before you purchase if it's flavored or if it's not flavored. And we'll be able to tell you. I mean, if you're at the Apothecarium, the staff and the pharmacists know which is flavored, which is not. Some people don't like the flavoring, some people do. Just all depends, you know, to each their own. But there's
Awesome.
both.
Okay, and the person who had asked the one question, she just mentioned about the 5-year-old. The side effects are exactly why I wanted to try this route versus medications that the physicians are recommending. Thank you for doing this presentation and for the information. It was very informative and greatly appreciated.
You're
So
very welcome.
yes,
Okay.
thank you as well, Tara. And thank you, Dr. Harris and Franmar. And just so everybody on the call knows, this has been recorded. So we will get this posted to our website, and we'll send it out to all the attendees. So you can watch it again. You can share it with friends or family or anybody else who you think may be interested. So keep a lookout for that in your email, because we'll send it to the email address that you registered with. So again, we appreciate everyone. Thank you so much for joining, and we'll see you next month for our next education session. Thanks, everyone.